Welcome back to the Conquer Your Lower Back Pain series. In the last episode, we explored the detailed anatomy of your lower back. The bones, discs, nerves, muscles, and how they all work together. Today, we are asking one of the most important questions in your recovery. Is your pain coming from physical structures like a disc or joint, or is it more neurological in nature? Understanding the difference is crucial because how you treat pain depends on what's causing it. And too often, people chase the wrong solutions because they've misunderstood the sources of their pain. In this episode, you will learn what physical pain means and when it's actually tissue-based, what neurological pain means and how the nervous system creates pain without damage, how to recognize the signs of each, how pain can shift from physical to neurological over time, the best way to treat each type, and how to recover when the pain is both. Let's dive deep and make sense of what your body is really trying to tell you. What is physical pain? Let's start with the classic view of the structural and physical source of pain. This is the type of pain people associate with lifting something and feeling a pop, injuring a muscle tendon or ligament, acute disc herniation, fractures, or inflammatory conditions. When there's trauma or overload, your body responds with inflammation, swelling, protective muscle spasms, and of course, pain. Examples: a disc bulge compressing a nerve root, a strained ligament after bending upwardly, a microfracture in the vertebrae due to osteoporosis. These physical issues usually present with clear mechanical triggers like bending or lifting, local pain that worsens with movement, predictable patterns like sitting makes it worse, walking helps, and response to anti-inflammatory medications, and visible findings on scan, though not always necessary. With proper rest, loading, and rehab, physical pain often resolves between 6 to 12 weeks because tissues heal. Now let's look at the neurological pain, or more accurately, neuroplastic pain or centrally mediated pain. This type of pain originates from the nervous system itself rather than tissue damage. It might begin after an injury, but it lingers even after the tissue has healed. Or it might come out of nowhere, no trauma, no disc issue, no strain, just persistent, confusing, often severe pain that doesn't respond to typical physical treatment. This is where pain science comes in. Pain is not directly measured by damage. It's your brain's protective response to what it believes to be a threat. If your nervous system becomes hypersensitive, it can sound the alarm even when there is no danger. Signs that your pain is more neurological than physical. Pain that spreads, moves, and changes location. Burning, tingling, or electric sensations without clear injury. Allodynia, pain from light touches or clothes. Hyperalgesia, normal movement feels very severe. Pain that flares up from stress, lack of sleep, or emotion. Symptoms that persist long after expected tissue healing time. And pain becomes less about tissue and more about nervous system being overprotective. Your brain learns pain, and just like it can learn to fear movement, it can also unlearn pain with the right strategy. Physical, neurological. When pain becomes chronic. Here's the important thing. There are two types of pain overlap. You might have started with a real strain, a disc issue, poor posture, or muscle imbalance. But weeks later, the tissue has healed, yet pain persists. Why? Some may ask. Because pain changes your movement patterns, your breathing, your thoughts, your sleep, your social behaviors, and your mood. Over time, the nervous system adapts to this new reality and becomes hyper-vigilant. It flares up danger signals even in the absence of injury. This process is called central sensitization. A good metaphor is like your home alarm system that becomes so sensitive it goes off when the wind blows. There's no thief, but the system doesn't know that. Your brain is trying to protect you, but it's misreading signals. This is not all in your head. The pain is real. It's just being generated by software and not hardware. And software problems need different solutions, right? How to tell the difference between physical and neurological pain. Understanding the nature of your pain changes how you respond to it and how you heal. But let's be honest, pain can be really confusing. It's not always obvious whether you are dealing with something physical, like a disc or muscle issue, or something more neurological like central sensitization or nerve hypersensitivity. But here is a clearer breakdown. If your pain is more likely physical, tissue-based, you might notice 1, a clear injury or mechanical trigger. Maybe you bent down to lift something and felt a sharp pull or strain, or you woke up with pain after sleeping in a weird position. This suggests tissue stress. 2, pain that follows a predictable pattern. Example, it hurts when you sit, it feels better when you walk, or pain increases when you bend or twist. These are mechanical sensitivities, often linked to joint discs or muscle. 3, short-term stiffness and pain that improves with activity. This is common in joint irritation or minor muscle sprains. Motion helps lubricate the joint and reduce your stiffness. 4, imaging findings match symptoms. While imaging isn't always needed, if an MRI shows a disc pressing on a nerve and you have a leg symptom that's matched that level, it supports a structural cause. 5, response to movement-based rehabilitation. Strengthening, stretching, posture correction. These things help because they are targeting the injured tissue. If your pain is more likely neurological or central, you might notice 1, pain that has lasted more than 12 weeks without clear improvement. Even if it started with an injury, it is now lingering despite rest, rehab, and time. This is often a sign that your nervous system has become sensitized. 2, symptoms that spread, fluctuate, or feel strange. Maybe pain started in your lower back, then it moved to your thigh, now it's in your jaw or your neck. Or you feel things like electric shock, pins and needles, burning sensations, and crawling feelings. These are classic signs of nerve involvement and central pain processing. 3, pain flares with stress, lack of sleep, or emotional triggers. If pain spikes when you are anxious, overwhelmed, or haven't slept, you are likely dealing with a nervous system that's on high alert. 4, you feel fearful of movement even though the scans are clear. This fear avoidance response creates more tension, stiffness, and guarding, which fits the pain cycle even if nothing is damaged. 5, pain with touch or normal movement. You feel pain when your clothes brush against your skin or when you are doing a light stretch. That's called allodynia, and it's a classic nervous system response, not a tissue injury. Use this simple checklist. Did your pain start after a trauma or strain? Then it's physical. Has the pain lasted for 3 months with no injury? Then it's neurological. Do you feel burning, tingling, or electric pain? Then it's neurological. Does your pain move or spread randomly? Then it's neurological. Does stretching or strength training help? Then it's physical. Does stress or poor sleep worsen your symptoms? Then it's neurological. You don't need to have just one category. You may have elements of both, and that's normal. What to do about each type? Let's be practical. You figured out that your pain is more physical, more neurological, or a mix of both. So what now? What do you do next? If your pain is physical or mechanical in origin, focus on 1, guided movement and not bed rest. Long gone are the days of lying in bed for back pain. Movement promotes disc hydration, joint lubrication, and muscle repair. Gentle walking, mobility drills, or light stretching can actually speed up healing. 2, progressive strength training. Focus on your glutes, your core stabilizers, your hamstrings, and your mid-back muscles. Strength doesn't just reduce pain, it gives you resilience. 3, mobility plus stability balance. Improve your hip and thoracic mobility while increasing your lumbar control. A stiff hip or weak glute equals more load on your back. 4, manual therapy or hands-on treatment as a short-term boost. Things like spinal mobilization, dry needling, or massage can reduce protective spasms. But they are not the fix, they are just a part of a larger strategy. 5. Tissue load management. Don't overload too fast and don't underload either. Find the right intensity that challenges you without flaring pain. And here's where physio helps. If your pain is neurological or central in nature, focus on 1. Education. Your first medicine is education. Learning that your pain doesn't always equal damage is neurobiological intervention. Moseley and Butler stated that just knowing this can reduce your pain intensity. 2. Nervous system regulation. Practice techniques like slow breathing, vagus nerve stimulation, meditation, nature exposure, and trauma-informed journaling. 3. Graded exposure. This means slowly reintroducing feared or avoided movements in a safe, controlled way. For example, if bending forward is scary, start with partial range, then reach, and then lift light weights, and then function. Graded exposure literally rewires your brain's fear circuits. 4. Body scan and somatic practices. Body mapping, neurotherapy, and somatic tracking improves your body's internal map and reduces pain distortion. 5. Sleep, nutrition, and emotional resilience. Pain intensity triples with poor sleep. Nutrition supports inflammatory recovery, and unaddressed trauma can make pain chronic. This is the life context part of healing. For mixed pain, if you are dealing with both physical or neurological elements, start where you are least sensitive. Educate your brain while moving your body. Use graded movements with relaxation. Use tracking. Keep your symptom log so you don't catastrophize flare-ups. Pain is never just in your muscles, or just in your nerves, or just in your discs. It's in your body, it's in your brain, it's in your history, in your beliefs, your lifestyle, your relationships, and even your environment. People who want real recovery ask questions like, what's keeping my nervous system in a state of high alert? What needs to change so I can feel safe and move better? Sometimes that means doing glutes bridges. Sometimes that means turning off your phone and meditating. Sometimes it means not panicking during a flare-up. Sometimes it means standing up to a belief system that says you are fragile or your spine is fragile. You don't have to fix everything at once. You just need to build safety in your system 1 layer at a time. Every breath you take, every step you walk, every movement you reclaim is teaching your brain that you are safe. And safety is the best painkiller. Wrapping up. So let's recap. Physical pain is often short-term and tissue-based, so treat it with load, strength, and rehab. Neurological pain comes from an overprotective nervous system, so treat it with education, exposure, and regulation. Most people have both and need both strategies. Your recovery is not linear, but it's always possible. Pain is not a signal to fear, but rather an opportunity to listen. And the more you understand, the more you control your regain. Your body wants to heal, your brain wants to protect you. Let's get them working together again. In the next episode, we'll explore why pain flares up, even when you are doing everything right. You'll learn how to manage flare-ups, calm your system, and stay on track even when setbacks happen. Like, comment, and share if this helps you reframe your pain.